There we go. Okay, so today we're going to be talking about what we can do to help nursing education and increase nurses' ability to just do a better job with things. Can you describe nursing in one word? If you had to pick one word, what would it be?
Caring.
Caring. Do you feel that most nurses are caring, or do you think that it's kind of a problem in the nursing field right now?
If your word is most, yes, I do. I do think most nurses care. Do I think all nurses care? No.
Okay. Tell us how an interaction with the nurse has made a difference in your life.
It just so happened that my daughter had come home from Ethiopia with a diagnosis of breast cancer. And she's 34 years old, and she went in and had a bilateral mastectomy, and she did in the plastics surgeon's residence came in. It was two women, and they came in, and neither one washed their hands, and they both came immediately in and started hovering over her. Now, she was, well, let's see, 6 hours post-op, so fresh wound. They didn't wash their hands, they didn't put on gloves, and they start removing her dressings without anything. And so then, of course, I stopped them and said, whoa, 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 you're not going to touch her, you're not going to take those off, wear your gloves, you didn't wash your hands. There was no indication of foaming in, foaming out. Now, as I've thought about this since, you know, if there's a foam machine dispenser right outside the room, it could be that somebody foams in outside the room and then finishes, you know, wiping their hands and then comes into the room. That's possible. But that whole communication piece of, for the patient, because now patients are so savvy, of does that communicate to them that that's been done? Well, of course, I said, you haven't washed your hands and wear the gloves. So then they rush out, and I can hear them say in the hall, wear the gloves. So they didn't even know where the gloves were on the floor. So it makes me really wonder, who had they seen before her that they were bringing in things,
Right.
and then going from her to someone else I mean, just basic issues of hand washing and gloving weren't even followed at all.
Do you think there's something specific that we can do to help educate nurses to really understand how crucial it is to do that?
Well, the CDC has a campaign that should be effective. Most hospitals now have signs outside the door that say foam in and foam out, or wash your hands. Most of them empower a patient to ask for these things. Not all, but many hospitals do that. And there is a campaign of heightening awareness of the importance of hand washing. I don't know if I said this in class, but I had just been to Thailand with the head of infectious diseases for the CDC, and I asked him, I said, what would be the one thing you would want me to tell nurses? And he said, wash your hands.
Okay, so as far as basic, I guess, education within the hospital, would you say that like the main thing to do would be to just make sure you're washing your hands?
No, I think some hospitals have been really good about empowering infection control departments to follow through on this. So that, let's say for an example, a nursing assistant is in a room cleaning a room, and she notices that a physician comes in, not even a resident, but a full physician comes in and doesn't wash, doesn't foam, doesn't do anything, and begins touching patients without having washed their hands. In some hospitals, even someone like a custodian is empowered to alert infection control as to who it was, and then infection control follows up with that individual that this was observed, we want to remind you. Those kinds of one-on-one reminders and accountability.
Okay.
Because not many professionals want to be told that you didn't even do something as simple as washing your hands. And so, you know, I think empowering people to hold others accountable regardless of status across the hospital is a great way to heighten the awareness and build habit. It's a habit.
Right. Yeah, I think that's a problem, though, is whenever you're, on the bottom of the totem pole and you immediately jump to the top. So some people, I feel like, are kind of afraid to do that because of,
Repercussions and fear of their job. But that's where that has to be organizational culture that says this is important enough that we're going to address this issue. I don't know if you remember us talking in class, but I would say that the South Carolina Hospital Association has that saying: see it, say it, fix it. Doesn't matter who you are, where you are in the hospital, if you see something that has the potential for harm, we should address it. And we should empower people across the organization to address it. And I think that's just really important.
Okay. Well, thank you.
Sure.